Hey, listen to the summary of the Week 31 report on articular cartilage repair.
Hi, Claudia here. I represent Cartilage.help, and today I will tell you about some of the most interesting developments from around the world in the treatment and regeneration of articular cartilage between July 24th and July 31st, 2026. As always, please remember that the information I share is not medical advice. Make health-related decisions together with your doctor or treating specialist. If you are a medical professional, please treat this material as inspiration for further research. Cartilage.help is independent. We do not judge a solution based on the country where it was developed. Just as in sport, medicine should bring us together. The full report is available as a PDF on our website. So let us begin. Week 31 clearly shows just how broad the field of articular cartilage regeneration has become. There was no single breakthrough, but several parallel directions. Chondrocyte epigenetics, exosomes, Polish work on an autologous cartilage patch, hydrogel scaffolds, and joint mechanics. The first important signal comes from China. A study published in the Journal of Advanced Research described a strategy called BR-CARS, which focuses on aging chondrocytes, the cells found in cartilage. The basic idea is straightforward. Instead of delivering new cells, the researchers are trying to change the behavior of cells that are already present inside the joint. In osteoarthritis, some chondrocytes become less effective at producing the cartilage matrix and may release inflammatory factors. In a preclinical model, the Chinese research team showed that it may be possible to suppress this program by changing the organization of chromatin inside the cell nucleus. In a rat model, this was associated with reduced activity of cellular aging signals and slower cartilage degradation. This is not yet a treatment for patients, but the direction is important. In the future, cartilage regeneration may also involve the precise reprogramming of cells already present inside the joint. The full report is available as a PDF on our website. The second topic is exosomes. A signal emerged from Russia concerning preparations for clinical trials of a therapy based on exosomes derived from mesenchymal stromal cells. Exosomes are small vesicles released by cells. In cartilage research, the most interesting question is whether they could both reduce inflammation and support the restoration of the cartilage matrix. This matters because traditional cell therapies are logistically difficult. They require living cells, quality control, storage, and precise administration. Exosomes could offer a simpler form of biological therapy, although their effects and safety still require careful evaluation in humans. The third signal comes from Poland. It concerns ArThec and an autologous cartilage patch. This is both a medical and a manufacturing challenge. It requires GMP conditions, process control, logistics, and the consistent production of patient-specific material. Signals like this show that Central Europe is also developing capabilities in advanced regenerative medicine. The fourth topic is Regentis and its Gelrin-C platform. Gelrin-C is a cell-free hydrogel implant designed to act as a scaffold for cartilage repair. What matters here is not only the biology, but also manufacturing, patents, and commercialization. Many technologies fail to progress because of cost, scalability, and implementation barriers. For a biomaterial to become more widely available, it must be stable, scalable, and practical to use in surgery. The full report is available as a PDF on our website. The fifth topic concerns mechanobiology, meaning the effects of mechanical loading on cartilage. Cartilage is not a lifeless cushion between bones. It is living tissue that responds to movement, pressure, limb alignment, the condition of the meniscus, the subchondral bone, and the way the joint is loaded. This is why questions about running, jumping, trampolining, or sport do not have a simple answer. Cartilage needs mechanical stimulation, but the dose, age, recovery, and condition of the joint all matter. Excessive loading, particularly in the presence of poor alignment, injury, instability, or meniscal damage, may have negative effects. Modern cartilage research increasingly considers the joint as a complete system. It is not enough to ask, which implant? We must also ask, what is the joint biomechanics? What is the condition of the meniscus? What is happening in the subchondral bone? What is the patient's activity level and overall profile? To summarize Week 31, the most interesting signals concerned the epigenetics of aging chondrocytes, exosomes, Polish work on autologous cartilage reconstruction, hydrogel scaffolds, and joint mechanics. Together, they form a map of the directions in which the world of cartilage regeneration is moving. Thank you for joining me. Take care of your health, move wisely, and make medical decisions together with qualified specialists. See you in the next Cartilage.help update.